Okay, good morning. I'm Mark Copeland. I'm the Value Analysis Whisperer. I help med device companies get their products approved in ambulatory surgery centers, hospitals, and health systems. And as part of our 2025 summer school on new product requests, we're doing our June version, which is what the heck is a business case? I'm Mark Copeland. Today's agenda, which I wrote here, but it will also be in our slides that we'll do for about 10 minutes, is what the heck is a business case? Well, why do we need one? How do we make them? What should they include? And I'm going to show you an example. And I have other examples I can send to you. This is designed to help reps and their companies understand the new way to sell into health systems, particularly, but also ambulatory surgery centers. It's not as simple as it used to be. It requires a new set of skills. I've been fortunate enough that I've had to learn how to do this, and now I teach people how to do it. And our job is to try to make the ultimate goal is MedDevice comes up with unbelievably great products that are better for patients, better for clinicians. How do we get it in their hands? And to do it, we have to do it professionally and appropriately because healthcare has changed. So we'll talk a little bit about that, but I'm going to show some slides to show you the importance, how we do it, what it should include, and what your business case, an example of a business case. But I have on the board here how I think we should format these, and it's a proven. You can look up business case, and you'll see other industries use them all the time, and I'll show you why. We really haven't had to do too much of it in med device, at least in my experience and in most people's experience. But we need to now. It's almost, it's probably as important as our clinical understanding is to be able to make a business case about our product to a certain audience. In July, we will be talking about who that audience is from my experience. And then the August will be how do we talk to them, that audience, about our business case? Because it's supply chain sometimes, but most of the times it's the business unit leaders. So I'm going to pop up some slides here. Make sure I got this right. Okay. What the heck is a business case? Right? So I like basketball. I think this is a team game. I think life's a team game. So I'm going to use basketball as a bit of a backdrop. So what are we covering today? We're going to cover why these business cases are important, and I would actually say required. How do we create them? What are the high points? And what do these business cases, what should they include? Because I want to demystify this today so that you could at least start thinking about it this weekend or whenever it is you are nice enough to watch this video. So first question is, why are these business cases important, or Copeland says required? Well, here's why. We are in a business of healthcare. Traditionally, it seemed like doctors kind of got what they wanted. And while that's still the case, and a great starting point, this is a big business, right? And it's the business of healthcare. The product that healthcare creates is outcomes, great outcomes, patient care, hopefully cures, sometimes treatments. But that's the product the business of healthcare creates. Who pays for it, how it should be paid for, it's a whole different discussion. But make no mistake, it's a business of healthcare. And if you don't care for that, I don't know what to tell you. It's the case. But we still have to be clinically sharp and still have to come up with better ways to treat patients every day. You count on it. I count on it for our own healthcare. So what is a business case? Right? So I have an example that I got from SlideWorks, and I'll be glad to send this outline to anybody that they have, but they have a really good one or a link to it. Business case is a written document, generally speaking, and articulates the business project or investment. But if you look at the bottom, the key is, what's the main objective? It's to persuade internal stakeholders to endorse the project. And that's what we're selling to now. We're not just selling to doctors anymore or nurses or end users. We're actually selling to a group that has internal stakeholders that are not necessarily doctors or nurses, but are very important. And what they want to know is, well, why should we be doing this? What's the rationale, right? And we want to know what we think we're going to get out of it, what it's going to cost us, what risks are we being put at by doing something new, or what risks have we mitigated by moving to something new? And what's the impact going to be? It's very simple. So you and I could sit down and make a business case for a restaurant or for buying a car. Can we do it for our product? And I'm going to show you how we do it. But it really isn't that complicated. And every resource on here I have documented that I can send to you if you guys would like to learn more. Okay. But understand, it's the value of a specific business project or investment that the internal stakeholders need to endorse. And to do that, they need to know how to make decisions and they need the information to make the decision. So, what does that mean? Well, a business case answers these questions. Why should we do this? What is the best solution? What will happen if we proceed? Okay, it's this simple. And if you can put it on a piece of paper, which you can, and somebody can read in 45 to 90 seconds and synthesize the high points, you will be amazed at how far this can move. All the stakeholders need to understand it, and you need to speak to all of them. But that's what a business case does. It does not need to be 42 pages. It's not a business plan. That's something different. This is a business case. Why should we do this? What do we hope to get out of it? And what will happen if we do this? Right? So hopefully that makes some sense. So how do we create these business cases? Well, I have stolen something from a friend of mine, Jim Surik, who's now CEO of a great small med device company, Valencia Technologies. You should pay attention to them. And I used to call it the Surik funnel. He would say, when we talk about our product, we have to think about the clinical, which is how does it help patients? How does it help the doctors or nurses who are using it? That's the clinical. And then Jim would say, we need to understand the financial components. What's it cost? Does it make us money? Does it save us money? What's the return on investment? Is there a return? Can we quantify it? And then his third part was strategic. And I always love this. It meant, does what our product do help our customer, who is the ASC or the hospital? Does it help their strategy? Does it help them attract doctors? Does it help them attract patients? Does it let them treat more patients sooner and better? Does it help them with KPIs? Those are strategic wins. But I've added a fourth leg to the business case table. So I've adopted Jim's funnel, and I've actually made it 4 legs. And we'll talk a little bit more about it. I have it up on my whiteboard. Clinical, again, financial, operational, and strategic. Because today, everyone's trying to be more efficient. Can we do more with the same amount of people? Can we do the same with less people? Because it's hard right now. It's difficult to hire. A lot of people retired. Tough business, right? And places are trying to do things more efficiently, more effectively. And does our product help with that? And oftentimes it does, more so than I think we anticipate. But we have to look at this, and that's why I have it in gold. This is not just from the standpoint of the patient and the doctor, which is what many of us have been trained on, but this is from the standpoint of the ASC, hospital, or health system. And so for you to be able to do that and to put these things through these 4 legs, or Jim's funnel plus 1 of strategic, or excuse me, of operational, we need to know what they need. We need to know these people as a customer. And that's what I urge everybody. If you, number one takeaway is, stop thinking about doctors and nurses and patients as your only customers. There's new stakeholders, and they are customers as well. And they are an entity. They're an ASC that has a committee. There's hospitals and health systems that have multiple stakeholders. Sometimes they're a value analysis committee, sometimes they're not. But they're not just doctors. And we have to be able to say, if you invest in our product, patients get this, doctors get that, and you may like it because of these financial, operational, or strategic things. And if you don't know what they are, you should be looking on the websites and asking these people in hospitals and health systems. I know what many of them are, but that doesn't make me special. I've just asked and learned. Okay. So what should a business case include? And I'll show you one. And I'll send you one if you'd like it. I just need your email. But the summary of the problem. Now, guess what? It's not the problem that you think it is. It's not the problem that this solves for the doctor or the nurse. They already probably buy in when you look at it, but you need to get it requested. You need to say, what's the problem we solve for the ASC? And I'll give you some examples. But like if my procedure in a hospital goes faster and the doctors like it because they're faster, because like I can do more, I can treat patients faster, I get more, right? They love it. But here's a problem that it also solves for the hospital or ambulatory surgery center. Because we're faster, you may be able to get more patients into your clinic. You might be able to book another surgery. You might be able to take another MRI because we've made it more efficient. The problem that the place has is that we would like to accelerate. We'd like to be able to do more MRIs in the same amount of time or with the same amount of people. We'd like to do more cases in that same window. The problem is we can't because our current way we do it slows us down. That's a problem that ASC, hospital, or health system cares about. So it's a summary of their problem. And then we start to put it through the funnel, Jim's funnel, or my 4 legs, right? And we want to talk about the options that include mine. But we have to think of ourselves as internal stakeholders. Mine's an option. You could just keep doing what you want, what you're currently doing, or maybe there's another alternative. But if you switch to us, here's what your team and I think your anticipated outcomes would be, and the return on investment or cost. Like people want this information. They're not going to do anything until they can put their arms and wrap their head around the problem they have. These 4 things: clinical, financial, strategic, operational. What are my options? Do I have to do this one? And what should we expect if we do it? That's what a business case includes. And again, I have free stuff I'll send to you guys to go deeper on this. So I'm going to give you an example of one. And I'm going to show you how we put this through the funnel. Okay. So I was helping a rep, very good rep, working in big health systems. I won't say where. And works for a well-known airway management company. But they have multiple competitors and they have multiple end users. So an airway management system can be used by anesthesia, respiratory, emergency department, used on floors where people have an emergency and they're either they need to breathe and they need to hook them up to something to help them breathe, right? And manage their airway. There's a bunch of good products out there, but there's a bunch of different end users, and these facilities want to go system-wide. They want to be able to use 1 or 2 vendors, not always because of cost. I'll show you why. And this rep called me and she's like, Mark, look, the ICU loves my product. The ER likes it. The OR likes it. And she said, my competitor in the OR, they love theirs more than mine, but the ER hates it and the ICU doesn't really like it. So she was talking about within a hospital, and then across the health system, everybody was sort of looking at different systems. One, and the hospital and health system did not want the ER to have one kind, the ICU to have another. And I'll tell you why in a minute. But what she had was thumbs up or double thumbs up in every department across the health system. But she was $70,000 more, And she worried about this because she was under the preconceived notion that everybody wants the cheapest product. And that's not accurate. Honest supply chain people will tell you we buy things that are more expensive all the time, but it's because we know the value on the back end, right? So, and the health system was struggling to make a decision. We have so many different places, so many different departments. They all have their own preference. But what she had was everybody liked hers. Many loved it. And her competitors were disliked by some in that. So what she and I focused on was building a business case to say, hey, listen, here's your problem. You're trying to come to a one decision and it's hard. You have all these people that are struggling, figure out which one they like. But here's the problem. The problem was that we can't afford to have multiple systems in here, not because of cost, but because we have employees that work at different ICUs and go across town and work at our other place. And we don't want them trained on different things. Like if you have an emergency airway, we need those people to be ready to go and know how to turn it on and use it immediately. This is time critical. And and she recognized that, but she was still saying, well, ours is better, it gives better visibility. I'm like, they buy that. But what you're underappreciating is they have employees who are going to different hospitals. The quality group there wants the same thing used everywhere because they have proven if you do the same process for these patients, outcomes improve because you get better and better and better at it. She had a quality point that was important. It was the same. So that was operational. Everybody knew what it was. Strategic. They were trying to do the same thing everywhere. And clinical, because they knew if you have the same process, that's a quality concept. Same process everywhere, outcomes get better. So she hit 3 legs of the table on the quality side. Training was probably quality and operational because they only want to train people on one system. They don't want to train them on multiple systems. How do you make sure people can be compliant and checked off? And were you trained on this? Well, now we got to train you on 3 different systems because you go to 3 different hospitals or you work in the ICU and the ER, and you don't want to go down there and go like, hey, what system do we use down here? And how do you turn that thing on again? And is it plugged in? Or that's a nightmare. That's a training nightmare and a compliance nightmare. They do not want that because then the Joint Commission comes in and says, show us your airway process. What's your protocol? And how do you know people are checked out? How do you know everybody that grabs this is trained on it? And that's a strategic mission for this health system. Staff comfort. They also wanted everybody to at least like what they chose, right? And people think they don't care. I promise. The leadership cares. They'd prefer to buy something that does these things and that everybody at least likes. Remember, she had this. And clinical satisfaction. All the clinicians, all of them were good with it. Some were great with it. Nobody was bad with it. She had competitors that were great, good, and not preferred. So we ended up putting a business case together on one page that talked all about this and showed her costs. And her costs were $70,000 more annually. No doubt about it. But the health system, when they understood this and the decision makers could say, oh, now we understand and can wrap our arms around it, they felt that $70,000 more was worth it to get better quality, better training, easier training, higher levels of compliance, make staff happy, and make doctors happy and comfortable. And it was worth it to them. She was sort of surprised. But when she went and talked to the right people and showed them this and had some of her internal champions talk this way, the health system was like, we're doing this. And they sent a PO because they could now make a decision because they understood both the clinical case and the business case. And a business case is not finances. It's more than that. So I'm going to switch to my screen here. So that's one of my business case stories. And you'll notice what we did with her product was we thought about what problem does the health system have that you might be able to help with. And we put it through these CERC funnels, but I call legs of the table, because if you can prop up all 4 legs, the table's pretty darn strong. And then we offered her as a solution to that problem. So the problem was you are trying to pick one system so that everybody's clinically acceptable, it's good for patients, and it's repeatable, and it's quality. So like quality means basically repeatable. Your people are more likely to be compliant. People are more likely to easily be checked off and comfortable. And they found that clinicians and staff were more satisfied because they at least were comfortable with it. They knew it would work. Some loved it. Most liked it. It was it was clinically acceptable. Now you'll notice I'm not talking about how strong the light is, how easy it is to use when you put it in the back of a patient's mouth, how it's potentially, it's a better way to do these things. Doctors already knew that. They already wanted our product. But when I turn around and talk to the business, they have different interests and different needs. And can we help them with those? So this is a business case. So if anybody has any questions, they can shoot them across to me. I'll take a deep breath here and say, so part of, if you want to get better at this, part of your homework would be, what problem does my product solve for an ambulatory surgery center, if that's where I sell, or for a hospital, if that's where I sell, or in her case, a pretty sophisticated health system. But if you just think about an ambulatory surgery center and hospital, does your product improve things clinically? Cool. Check the box, right? What's it cost? What are they currently paying for what they're currently doing? If you don't know, you might need to find out. You don't have to be cheaper. In her case, she was more expensive. That was one of the reasons I used it. But if this ran this place, are they going to see an increase in their budget, or is there going to be an increase in their budget over there and a decrease over there? Help them wrap their heads around it. Does this help us do more with less? Does this help us do the same with less because we're already understaffed? Maybe it does. They won't necessarily understand it. But if you can put it on one piece of paper in an overview, a summary of your business case, that's helpful. And then strategically, you'll notice when we were talking about it, they had a strategic goal of trying to make sure everybody was compliant and checked out, and they wanted happier doctors and they wanted happier staff. And they felt that by picking her system, everybody was at least satisfied and maybe thrilled or happy. And it really didn't have to do with how easy it was to see. They assumed that was the case. But what they did want to do was, hey, this also helps us be compliant with Joint Commission, repeatable, right? That's a business case. So what I tell people is, when we put together a business case, what's the problem we solve for them? And if they don't know it, I sort of make them understand it. And we have slides to tell you certain KPIs and things that matter to health systems. But the sooner you start thinking of ASCs, hospitals, and health systems as an entity and a customer that you must get internal buy-in with, the better off you are. Because you can't figure out what problem they have that you might solve if you don't even know what they are. And it's more what than who. What is important, then who follows. And then, can I put my product through these things? And then can I look at what they're doing? And then, does my solution help with this? Or at least how much? What would it cost? So hopefully this helps people understand what a business case is. I have examples. If you want examples, just connect with me on LinkedIn and say example, business case example. What we do is show it in a summary. But if anybody wants the executive business summary that I wrote for internal use only for this exact business case that I showed, email me or connect with me and just say executive business summary. I'll send it to you. You'll see what we did. And I'll bet if you read it, you'll go, oh, boy, I probably would have done the same. I would have made the same decision these people made now that I understand the problem. And that's what you ultimately want is, can people who aren't doctors but are important stakeholders, can they understand what's being proposed? What's the problem that we, the health system, have? What's it look like, sound like, smell like? Is it affecting us from a financial standpoint, strategic, operational? And does this thing that girl sells solve that? And how? And if we do go with them, what should we expect? If you can do that, you will get products approved where you deserve to get them approved faster, because the decision-making process is so much faster. Because here's what value analysis committee members look at. This is what they look at. This is the language in which they speak. Business summaries, business cases. And so do the business people in the health system. This is how they think. If you give this in a language that they understand, in a format that they understand, you will be shocked at how fast your product, if it's good and has a good business case and meets that health system's business needs, how fast you get approved. I help companies with their business cases. I help reps when I can. And this is repeatable. I have done this for multiple products that I sell and multiple products that other reps sell in different parts of the country, in different types of customers, in ambulatory surgery centers, hospitals, and health systems. But I try to make this DIY. If you follow at least my guidance and do these things, your success rate will increase dramatically. And in July, I will say, okay, cool. Here's who we need to take these business cases to so that you know who they are. And we're going to point to them. We're going to tell you what their titles look like, what they sound like, who some of them are. And they might not be who you think they are. I've found that too. So that'll be step 2 in this summer school. First one is what the heck's a business case? Second one is who needs to hear the business case? And then number 3 in August will be, okay, now how do I present it to them? Because I don't even call on these people oftentimes. You'll be able to. I'll help. As you know, you can do it. I will help. Oh, I just got a question from Tom Beckman, and actually a really good one. Are there differences in how you present these to the ASC? Very little. I have found, Tom, that if you do this, it works both like the scales, right? ASC, hospital, health system, if you think about from a complexity standpoint. But it also tracks across the country so that if you have a good business case, and it's always a little bit different, but like you could take it from ASC to ASC, and it tends to be singing in their key, or hospital to hospital, or health system to health system. We all know not everybody's the same, but it actually does translate. I have found very little difference between delivering this message to an ASC administrator or a VP of surgical services in a large academic center. So great question. Hopefully I answered it. And if you have more specific questions, just ping me and I'll be glad to answer it a little bit better. And I'll show you some samples too. But yeah, it tracks because it really is as simple. We used to just have to show people how clinically relevant and good our product was. Now we have to sort of show what's the clinical benefit and why we're relevant, and what's the business case. And that's what's changed so much over the past 10 years. So when you have good business case or cases, they travel, as we used to say in hoops. They go on road games. They travel well. I think like once you have a sense of it, you basically have close to what you need everywhere you go.